Well, it's a moment, what a day. By now, we should have been able to get that connection to the Minister of State for Health, Dr. Mamora. We're having some glitch. We should be able to connect pretty much later. About starting now, because today Nigeria received the first batch of its COVID-19 vaccines as it prepares to roll out vaccination programs and schedule. So Nigeria now has joined Ghana, Ivory Coast, as countries who have so far received the vaccines through the COVAX facility. Ghanaian President Nana Akufo-Addo and his wife Rebecca publicly took the COVID-19 vaccine on Monday. The president followed in the footsteps of South Africa's Cyril Ramaphosa as African leaders try to demystify the tension building in some people on the continent by being good examples. Will Nigerian leaders follow this path? And these are some of the things we'll be looking at pretty much when we connect to Dr. Mamora. Nigeria now, as you already know, has received 3.92 million doses of AstraZeneca vaccines. Ghana and Ivory Coast received 600,000 and 505,000 doses respectively. Frontline health workers and strategic leadership will be first to receive COVID-19 vaccine in Nigeria. So also of priority are people aged from 50 and above, and also people with morbidities. The Nigerian government has set out electronic registration for the vaccination programs, with house-to-house registration also on the cards. Now, in South Africa, there are far fewer cases of coronavirus being reported, with the daily total now below 1,500. That's a significant reduction in comparison with more than 22,000 recorded daily in January. So the nation has rejected the AstraZeneca vaccines as it's not potent enough for the dominant variant of the disease in the country. South Africa has contracted Johnson & Johnson for 11 million doses and is also expected to receive 20 million doses from Pfizer in the second quarter of the year. Now, for many African countries, their vaccines will come from the COVAX facility, while South Africa says it will be securing, the vaccine availability. For now, many African countries cannot say same as South Africa, but for some other African countries, they've been advised to borrow relief from that country in a response to the disease. We're hoping to have this conversation when we return after now. Join us again. Well, the show must go on. You call it what a day, but again, that's how it does happen sometimes when it has to do with technology. But the good thing here is that we actually moving on with the breaking story, which is President Muhammadu Buhari declaring Zamfara State a no-fly zone area, and also putting a ban on mining activities in that state. What all these mean for a lot of people is what we'll be discussing. Keep in mind that 4 days after the abduction of the students from their hostels, students of the government girls' secondary school, Zamfara State in northwest of Nigeria, regained freedom, while Nigerians celebrate that safety and safe return of the girls. The dire state of security in the country leaves a hole to fill. Just after that, President Muhammadu Buhari has also met with security chiefs, and it was after that meeting he came out to say Zamfara State has been declared a no-fly zone and putting a ban on mining activities. Joining me to, unwrap this is a preventive security analyst, Temitope Olorunnimbe. He joins me from the United Kingdom. Good to have you join me, Temitope. Quickly here, what is happening in Nigeria and Zamfara in the mix? Niger State, as well as pockets of other kidnappings we have seen in the country, looks to some as what you have highlighted before here on VSA. Tell us what you think now.
Is that a question for me?
Absolutely.
Oh, okay. Thank you so much for having me once again. I think there is a challenge here. And the challenge we have, unfortunately, is that we're in a state of chaos. From April 2014, which is about 500 days, we'll be having all kinds of spectacular kidnapping taking place in Nigeria, from 276 kids that were kidnapped in Borno up to 371, which is now a disputed figure, in this latest incident. Well, it's more to many Nigerians a deja vu. But I think there is need now for us to really sit down as Nigerians and ask our questions. Are we keeping our children safe? Have we done enough to ensure safety and security in the school space? From what I'm saying, we have not done enough. And there is need for all good people to come together and start reviewing safety and security within the boundaries of our schools.
While you're on this show, we had spoken about small and light weapons coming into the country, but lately we have seen some of the bandits with RPG. Do you think that could mean, while the president of Nigeria has just declared Zamfara State a no-fly zone?
I would not be surprised that might be one of the reasons, and I think we should look at the decision of the commander-in-chief, vis-a-vis his decision also to close down the mines, because the gold mine seems to be attracting all kind of elements of people, and we don't have record of who is coming in and who is going out, and there is need for government to checkmate criminality. And we cannot allow criminals to run riots within our borders. And that is the reason why there is need to checkmate criminality and violence extremism that is happening across the length and breadth of Nigeria. And if this is the first decisive step taken by Mr. President, I would say kudos to him. There is need for him to show the general side of him, which is what he's showing now. Many Nigerians will be pleased with this decision.
You just opened a new angle here, talking about the categories of persons who are involved in mining activities. Some Nigerians have also alluded to the fact that some of those mining in Zamfara State are non-Nigerians, and not one has actually had a brush with the bandits. So how come a place that is unsafe for law-abiding citizens and even some people, those in the business of mining, seem to be immune from the terror of the bandits?
I will not be surprised. It reminds me of most of the Western films we used to watch as young people, and even some of the Chinese films where people pay money, to stay in a particular area. You found out that most dangerous areas are actually the most safest place for people within that community if they're willing to abide by the rules of the jungle. And that might be the situation that we are dealing with. But I think many Nigerians will be asking our security services, what are the top 10 security challenges that we are facing in Nigeria at the moment? And what are we doing to de-escalate or to ensure that violence extremism is reduced? Because I'm happy that at least most of the schools, most of the states like Sokoto State and the others are closing the boarding schools, because those places are not safe. And we need to put in place proper measures. We know so far, touch wood, only one university have been more or less prone to attack by terrorists. All the other universities are safe, which means that super school is the best concept of how to keep our schools safe. All these schools with no fence, with no proper security measures, with no security audit, with no risk assessment, with no security drill, with no crisis communication strategy, are a waste of time. And we need to start putting the life of our children, as priority, because every Nigerian life matters.
Let me bring it back to you, because you just asked a very big question of the security chiefs. What do you make of the security challenge or challenges Nigeria is experiencing at the moment? As an expert, which stands at top?
There's so many. The fact is that we're being slapped left, right, and center. And the good book says that when we are slapped on one side, we should turn the other cheek. But in this situation, I don't think any Nigerian wants to turn the cheek. Most Nigerians want a resolution to the challenge that we are facing. But it seems as if we have the fire approach service to how we deal with issues. And that should not be the case. The question is, and I agree with the president 120% when he says that school owners need to own responsibility. There is a responsibility with the president and commander-in-chief. But there are some responsibility which the schools cannot shy away from, because they are vicariously liable for any criminal act that happens within their school place. And the question that we should be asking is, why is it that we are having 317 numbers and after we're having 279 numbers? Why is it that we've never had of the risk register for that school? Why is it that there's no skill audit, security audit? There are things that schools must have in place. And look at the state of that school. Even a dog will not live in such an environment. And those are the kind of things that we need to hold these people accountable. And we're not holding them accountable. We want to put everything at the doorstep of Mr. President, which of course he is the father of the nation and should be taking responsibility for most of the things, because the boss talks with him. But the bottom line is that every one of us have a responsibility when it comes to safety and security of our people.
I think I'll take a moment off security matters. I'll come back to you, Temitope Olodo in the UK. Let's quickly bring in Nigeria's Minister of State for Health, Dr. Mamora. Good to have you join us here on Village Square Africa, News Central Television.
Thank you very much.
Apologies, good to hear your voice at last. Sorry for all that glitch. It's a great moment, I'm quite sure, within the Nigerian government circle, as well as every part of the country, that have seen that you finally received the much talked about vaccine. Tell us the feeling within the ministry first.
Well, it's a feeling of excitement, and that at least we're doing what is expected of us.
Well, anyway, this first vaccine that arrived today from the COVAX facility, how does the government plan to ensure these vaccines are not found in stores who may, want to sell them?
Yes, that is very important. We usually say that there are 6 A's of vaccine administration, of course, starting from the availability, affordability, acceptability, and of course, administration and accountability. So you are talking about accountability. This is one vaccine that is, the entire world is scrambling for, so to speak. So we cannot afford to allow it to waste. Therefore, it should be monitored very, very closely. And the lead agency, which is the National Primary Healthcare Development Agency, that's the lead agency that is responsible for managing these vaccines. So we we have a process in terms of deployment, which is tight, tight in the sense that it has to be monitored by so many agencies, starting from the Presidential Task Force itself, the Federal Ministry of Health, and of course the National Primary Healthcare the Development, NPCD, National Primary Healthcare Development Agency. And of course, we are also bringing in a lot of agencies. We are bringing the ICPC, the DSS. We are bringing in all the security, outfits, so that we ensure that we are even bringing in the civil society as well. So to ensure that no vaccine is missing, we must be able to account for every vaccine that is deployed. And of course, we won't just deploy to states without ensuring that the states we are deploying these vaccines to are ready in terms of everything, in terms of the cold chain maintenance, in terms of logistics, in terms of personnel, in terms of the transportation. Everything will be put in place so that we are not losing any of these vaccines.
In times past, Nigeria has done very well when it comes to immunization, especially when it comes to polio. Tell us what lessons or what examples of lessons, rather, that you'll be employing from the polio vaccination in the country. Yes,
the first is to say that you recall that we were just, some months back, that was precisely in August last year, when we were certified, polio free. Now, the experience from that was that we were able to cover the entire country, and particularly the areas in some parts of the northern region of our country. And hello.
Yeah, I can hear you. Go ahead.
Yes, we were able to cover all the parts of the country, and even had to reach areas. We were able to reach them. So the experience of that will come in handy for us in this case of COVID-19 vaccine. Of course, the logistics, the personnel, and just everything within cold chain issue. We didn't have problem with that. That was why we were able to do what we did then. So all these are there to stand for us with this COVID-19 vaccine.
Now, you just mentioned the northern part of Nigeria as one of those places pretty well covered by Nigeria in its polio vaccination. How do you hope to cover, or rather eradicate, skepticisms in Nigerians? Because some Nigerians are not ready to present themselves for vaccination.
Yes, we all along have anticipated that, what we call vaccine hesitancy. And to that effect, we had reached out through National Primary Healthcare Development Agency, reaching out to the various segments of the society, particularly through influencers like the highly respected traditional rulers, through political leaders, through community leaders. So, and we have all along tried to build a kind of trust, and to let people know that this is in their own best interest. So that education, that sensitization has been on even prior to the arrival of the vaccines. So what we need to do now is to sustain that trust. And of course, because we will also be giving this vaccination to the strategic leaders, that is, even from Mr. President and the Vice President and the members of the National Assembly, the Senate President, the Speaker, and of course the members of the Federal Executive Council, so that this will be done in the open, so that people can see that truly this thing is safe. Of course, where people get anxious, it may be due to ignorance or not really knowing what they need to know about this vaccine, because it is the ultimate in a pandemic of this nature. It is the use of vaccine that is the ultimate, and that is why it's a global thing at the moment. So we will try to build that trust about the efficacy and about the safety of the vaccines. We have been doing that prior to now. We will only ensure that we sustain it and generate demand among the people.
Well, be rest assured that News Central will help you in that sensitization program. But quickly, something that concerns many Nigerians, the Nigerian B1525 variant contains the E484K mutation, which is also found in the South African and the Brazilian variants. These are variants of concern, believed to evade the natural and vaccine-triggered antibodies. Now, meaning this mutation provides the virus the capacity to escape antibodies neutralization, leading to less effectiveness of the vaccine, in this case, Oxford AstraZeneca. If this is the case, as a medical expert, is Shield effective against the B1525 variant?
Hello?
I can hear you.
Okay. Now, what we have found out so far is that these variants of concern, as you rightly referred to, these variants have not been established here in Nigeria. And to that extent, we do not have reasons to be apprehensive in any way. So we are going ahead to administer the vaccines because we have not established these variants of concern here in Nigeria.
So quickly, take us through how the process is going to be. You already said, it's going to be leadership, or by example, you have all the leaders, the president down, all the political leaders publicly taking the jab. Who's next on the list?
Well, from the rollout that we tried to announce yesterday, I remember at our presidential task force briefing, with the arrival of the vaccines today, between tomorrow and Thursday, that is Wednesday and Thursday, the NAFDAC, which is our own regulatory body in this regard, will take some of the samples and just do the routine analysis on them based on the dossier which had previously been submitted to them. And by Friday, we will then commence the vaccination, which will start at the National Hospital in Abuja. This will commence with the vaccination of the frontline health workers, and of course, not just the professionals in the hospital, that's it, professional health workers, but even cleaners who work in the frontline areas will also be vaccinated. And of course, when they are vaccinated, they will be registered electronically, and they will receive the COVID vaccination card, which is a kind of evidence that they have been vaccinated. And of course, this vaccination card they will receive has a barcode that can be verified anywhere in the world. Then on Saturday, the train, if you like, will move to the villa where Mr. President will be vaccinated in front of the camera, so to speak. That is, it is to give credence to the fact that this vaccine is safe. Then next week, by Monday, God willing, it will now move. By that time, we will have set up various vaccination sites, like in the National Assembly Clinic, in the State House Clinic, and of course, at the Federal Medical Center here in Abuja at Jabi. So we'll have set up vaccination centers, and various people, what you can call the strategic leaders, will also be vaccinated in these various, like the site at the National Assembly Clinic, with the Senate President and the Speaker will be there to be vaccinated. And so, as well, members of the National Assembly will be vaccinated there. Of course, at the center, at the State House Clinic, some others who are seen or grouped as strategic leaders in the country will be there, like ministers. They will also be vaccinated at that center. And of course, some others, like the Secretary General of Police and the heads of some of these agencies, they will be at Federal Medical Center, Jabi, to be vaccinated. So that is on Monday. And of course, thereafter, we will now go into vaccination of the frontline workers in the various states. The National Primary Healthcare Development Agency has a list from each state of people that are being grouped in the various states as strategic leaders. Of course, especially that starts with the governor of the state and other people in the state that will have been categorized in that group who will be vaccinated. And then we then move thereafter to what we now call the phase 1 of the vaccination process, in which case we will now be deploying the vaccines to the various states. But before doing that, we have to be very sure that whichever state we are deploying vaccines to is ready in terms of logistics, in terms of cold chain storage, in terms of transportation, in terms of security, in terms of the personnel that will administer the vaccines, because this will be in line with our bid to ensure that there is vaccine accountability.
Absolutely.
And we will not just give the vaccines to states that are not ready. And of course, the National Primary Healthcare Development Agency staff will be on ground to assess readiness of this state. So this is, and of course, the first group that will vaccinate will be those above 50. Right, when I say above 50, of course, we will have those between 49 and 50 to 60. But between, in that age group, we will also look at those who have comorbidities, that is, hypertension, diabetes, lung disease, liver disease, or whatever. Because these are critical groups that we have to take care of.
Quickly here, sorry to cut you quickly here before we wrap up. How do you go about recognizing these people? Are you going to get information from their personal physicians to know that they are people with such critical ailments?
Well, you know that even right now we already have online registration. And from the information supplied, this will be cross-checked to establish the true status of these people that have registered, so that we will be sure that nobody is impersonating or no one is claiming to have what he or she does not have. So we have the ways of cross-checking whatever facts or whatever information supplied through the...
Absolutely. It's a fine place.
National Primary Development
It's a fine place for us to rest it, Dr. Mamora. Thank you for your time, and thanks for logging back on to give Nigerians and Africans this very lucid program.
Thank you very much.
Of vaccination in the country. Nigeria's Minister of State for Health, Dr. Mamora, telling us how the government hopes to embark on vaccination of people in the country in the days ahead. Very quickly, we wrap up our conversation with Temitope Olodo. Thank you very much, Temitope, for holding the line. Quickly here, this is something that we hope to continue in the days ahead. Let's look at, ways by which the people can help the country, get out of the mix. Recall you had said something about not negotiating with terrorists, but it would seem as if this has always been, and that is why we have continued to witness kidnappings of people who are meant to be protected by the state. Tell us what you've been able to, unpack going by what has been happening in Nigeria's northern region. Well, I'm afraid it looks like we have lost that connection to Temitope Olodo. I hope we get him back again, because there are insinuations, conspiracy theories maybe, that key players in Nigeria may be beneficiaries of this wanton abductions. We're trying to make sense of it. Recall also some of the governors have alluded to the fact that some of the names being bandied about concerning the abductions of young girls and schoolboys in northern part of the country, and names in quote that would shock Nigerians. Now, looking at what has happened in Jangebe in Zamfara State and a couple of other kidnappings, the government of Nigeria has finally placed a no-fly zone in that state of Zamfara, as well as putting a ban of the very busy activity of mining in the state. In the days to come, we'll try to unpack that and make sense of what that means. Keep in mind that came about after the president had met with the security chiefs before he placed that ban on mining activities. If there is a nexus between that and that ban, is something we should be able to establish in the days ahead. Also, here on Venice Square, we had the Minister of State for Health in Nigeria giving, for the first time, bit by bit information of how this is going on in the country in terms of vaccination, how the president and key players in Nigeria's political space will be seen to taking the jab live on camera, and of course, talking about those who have well-established health conditions, as have been seen through the online registration, will be next. And of course, state governments must be able to show cause to their readiness to take in the vaccination before such will be deployed to such states. Well, it's been a day of technical glitches. Seems that we can't get Temitope. But again, closing on this, 4 days after the released girls, talking about the girls were released from the 4 days after the abduction of the girls, I beg your pardon, the government has announced that they have been able to take them for medical attention and a few other things that they will go through. Psychological attention is also very key here. It was also said that the government is putting in place key structures to ensuring that this never occurs in any school in Zamfara State. Well, that's it on The Square today. Two key issues we've been able to dissect. But again, we'll continue on these two key issues tomorrow on VSA. I'm Sulaiman. Many thanks for watching.